Welcome to Health Talk. Today we're going to talk about diabetes quick facts, and we're going to do it in Vietnamese and English. To our home audience, this is our first time that we're going to do it in Vietnamese and English. We have with us today Kimberly Pham and Victoria Phan. We're going to talk about what is diabetes. We feel that diabetes affects 26 million people in America, and many East Asians are at risk because we have the metabolic syndrome that can push us towards that. So Kimberly, let's tell the home audience what is diabetes, that there is no, the insulin which is secreted by the pancreas is insufficient, or that the body can't make use of it. So tell us in Vietnamese.
Bệnh tiểu đường là một cái bệnh khi có hai loại. Loại số 1 là khi cơ thể của mình không có sản xuất đủ loại insulin. Loại số 2 là khi cái cơ thể của mình không có sức xài cái insulin được. Okay.
And then it also causes affects all the small vessels in your body. And the smallest vessels that can be seen easily are in your eye. So that's why sometimes people have numbness in their fingers and toes, because the smallest blood vessels are in your fingers and toes. But in the eyes, we can see it because we can dilate the eye, and then we could see all these small blood vessels. So tell us in Vietnamese for our home audience about that. You also wrote a book. Show us the book.
Yeah, so we wrote a book on diabetes quick facts. So cái này là một cuốn sách viết về bệnh tiểu đường. Cái này là viết trong tiếng Mỹ và tiếng Việt luôn. Thì ở đây thì mình nói về bệnh tiểu đường. Xong rồi ở đây nói là trong toàn thế giới 382 triệu người bị bệnh tiểu đường. Ở Việt Nam thì có 3.2 triệu người bị bệnh tiểu đường. Thì nếu bạn bị tiểu đường, bạn phải tự hỏi mình, bạn có ngứa răng hoặc tê trong ngón tay hay là ngón chân không? Bạn phải biết cái lịch sử gia đình của bạn. Nếu có ai có bệnh tiểu đường trong gia đình thì bạn cũng có cơ hội, có nguy cơ cao để bệnh tiểu đường.
So the family history is also affected. So if your parents have it and your grandparents have it, you're going to have a tendency to have it, and you may be at risk. So it's important to check your fasting blood glucose and something called the hemoglobin A1C, which is like a 6-month report card of your diabetes. So for 24 hours, you could be a very good person and not cheat and have a very good score, but the hemoglobin A1C checks how many little glucose molecules are attached to your hemoglobin. And that tells you whether you've been a good boy or a good girl for the last 6 months. So did you tell our home audience about that, the importance of checking?
Okay. Yeah, so hemoglobin A1C là một cái số xét nghiệm đặc biệt để biết cái số lượng đường trong máu trong thời gian thường là 6 tháng. Hemoglobin A1C cao hơn 6% là rất là nguy hiểm. Cái đó là bạn có thể bị bệnh tiểu đường, so bạn phải đi khám bác sĩ để tìm ra có bị bệnh không.
And Victoria, we've been to South San Jose, and we've seen clinics where there are many Vietnamese patients, and many of them don't understand about diabetes. Tell us what you think about that. You grew up in San Jose.
I think part of the problem is because a lot of the Vietnamese population, they don't know about the resources that are available to them. So what would help is if they ask their doctors more questions, or if their doctors let them know what resources are available to them, or not just their family doctors, but also maybe optometrists and chiropractors, just any doctor or any health professional, that would help. And if you know about it, then you can also tell your family members and your friends about it. So word of mouth is also very important.
And you were also with me in these clinics, Kimberly. What did you notice?
I also noticed that a lot of people didn't know that diabetes can affect the eye. So a lot of them actually come to your office and are diagnosed with diabetes for the first time. A lot of them don't receive checkups regularly for that, and it's important.
Yeah, they come in with severe eye disease already, and they don't know. They just think they need glasses. And then we dilate their eyes and look at the inside of their eye, the retina, and that's where we can see things can go wrong. And we're able to show them. And then we wrote this book in English and Vietnamese. And Kimberly, when you were writing this, what did you learn that you thought was really interesting?
So like, I learned a lot about diabetic retinopathy. I didn't know about that before writing this book. So it affects a lot of people in the United States, and then it can lead to decreased vision over time. And then people who have diabetes for more than 20 years are at greater risk for diabetic retinopathy.
So 26 million people in America have it. 1/3 don't know that they have it. And in Vietnam, they think it's like 3 million. Is that right?
That's correct, yeah.
And you visited Vietnam also. You were in a health clinic. Tell us about those experiences and what led you to be interested in writing this book.
Yeah, so it was a really interesting experience being able to go to Vietnam. We saw a lot, there are a lot of diabetic patients in Vietnam. A lot of them live in poor conditions. They don't have a lot of access to resources. So it felt really nice to be able to go in and bring medical exams to them. And so a lot of them didn't know a lot about these health issues. And so writing this book is really, it's a good tool for them. They want information, but they just don't know where they can get it.
So if, for example, if they know that diabetes affects the smallest blood vessels, and the smallest blood vessels are inside in the eye here, what happens is that sometimes they come to us, instead of seeing blood vessels that look nice and linear like little lines here, little red lines, instead you have big globs of blood on top of it, or the entire middle cavity here, instead of being clear, it is filled with blood. And now we have new medications that can really bring back vision. And in the past we had laser, we still use laser, depending on the severity of the disease, and also if they have very severe disease, they need surgery. But before we get to that point, we really just want to educate everybody who needs to know about this. And in San Jose, we're the largest Vietnamese population in a city. Orange County is the largest in America in a big area. So we felt that this type of outreach by this book was very useful. Now, the book also show us the graphic where how many people have diabetes versus none.
Okay. Yeah, so we have a graph here. So this shows the prevalence of diabetes. This is globally we have diabetes affects about 8% of the population. In the United States, it's closer to 10%. So that's a pretty big difference. And then here we show a graph showing the prevalence of diabetes across different countries. So we have China, India, Japan, Korea, and Vietnam.
So China's
China,
number one,
yes.
96 million, and they think India is around 28 million or around there, and the U.S. is 23 to 26 million. And what happens in the countries such as China and India is they're still underreporting because not every village can be screened or be in a computerized base, especially in India where the World Health Organization thinks that that number is low because that's only maybe in the cities. And the infrastructure for public health is not like that in America. But tell us also that in our Vietnamese population, they don't understand about diet, the importance of diet. They're told to, change their diet, but they don't know what that means. So Victoria, you hinted at that. So tell us a little bit about what like rice is no good, added sugar is no good, and Vietnamese food uses a lot of rice. Tell us about the diabetes cookbook. We wrote that in our office.
Yes, so here's the 50 diabetic menus, and here there are recipes for people with diabetes. And it's not only limited to people with diabetes, there are also vegetarian options in here as well. And there are a lot of fish recipes as well as chicken. And again, like I said, if you're vegetarian, there are tofu options. And what's important in here is that there are a lot of herbs added in here, herbs such as basil and tarragon and cardamom, and there's also no added sugar and no oils in here. The sugar that we use would be artificial sweetener, because what's bad about sugar and oils is that it would convert into more sugar in your body and add to your diabetes and add to it would further increase the risk as well as the symptoms of your diabetes. So we don't want that, and that's why we have a lot of herbs as well as no oil, a lot of alternatives to those recipes.
Now, we also say in the book, we have tell them things like what to do and not to do, like no smoking.
Yeah.
So let's tell our home audience in Vietnamese
Okay.
some of these things.
Okay. Yeah, so nếu bạn bị bệnh tiểu đường, bạn nên đừng có hút thuốc hay là uống rượu. Bạn nên tập thể dục mỗi ngày khoảng 25 phút. Tại nếu bạn bị tiểu đường, bạn có cái nguy cơ cao bị bệnh đột quỵ hay là bị bệnh đau tim. Mà cái này là rất là nguy hiểm tại những người bệnh tiểu đường mất cái dấu hiệu cảnh báo. So bạn phải coi chừng nha. Okay.
So you can have a heart attack and not have any chest pain and diabetes. So it's important to know if they have any chest discomfort to really go to a doctor, because they will not be the type of severe chest pain, because they don't have the nerves that everybody else has around the heart, because those little blood vessels that supply that have already been damaged. So that's sort of silent chest pain. And then also the high risk of stroke as well. Did you tell them also about the importance of no smoking?
I did.
Yeah.
No smoking and then no alcohol consumption.
Right.
Yeah.
And sometimes they can test their own vision at home. They can look at a newspaper or look at something called the Amsler grid. And this Amsler grid is just like black and white graph paper. And they would stare at the center dot, cover one eye, look at the center dot, hold this 16 inches away like for a book, and then they'll see either straight up and down lines or wavy lines. Wavy lines would mean that that one eye would have a problem, whereas up and down straight lines is okay. So then they would repeat it covering the other eye, same thing. Now if you don't have this Amsler grid, you can just take a newspaper, look at the small print, cover one eye, and you might be missing the A or the B, and whereas the other eye would not be. So this is like an early sign of diabetes. Many people think that they just need new glasses, but truly there's something going on in their eye. So for example, if you have an eye like this, so the total eye looks like this, and then when we dilate the eye, we're going to see the inside of the eye. And what happens is that when you look inside the eye, we as ophthalmologists look at the area that allows you the best vision, called the macula. That area gives you the ability to see the ABCD in the San Jose Mercury News or the newspaper, or to see these lines really sharp and clear. However, if those tiny blood vessels around there are leaking blood, we have something called macular edema. That macular edema makes this nice smooth surface, instead of being nice and smooth like I'm running my hand around this, it instead is swollen. So imagine if we're standing inside this room, our studio, and all three of us are sitting in the area called the macula. We're lying on the ground, we're sitting in this room, and our nose is facing up in the sky. We're lying and our feet are pointing that way. So we're looking up into the sky, so the area we're standing. So instead of being nice and flat, where Victoria, Kimberly, and I have all our feet and this nice ground is flat, imagine it's all bumpy, muddy, raised, and you're stepping in like sort of puddles. That is macular edema. So instead of being able to see, that would be difficult. So that's the most, sometimes the earliest sign of diabetes. And so tell us, a home audience, about that about macular edema and early signs of diabetes.
Yeah, so nếu bạn có nguy cơ bị bệnh tiểu đường thì bạn nhìn vô cái hình Amsler grid. So Amsler grid là giống một cái cái hình Amsler grid đó. So nếu bạn muốn thử mắt thì bạn nhìn vô cái nhóm đen này. So mấy cái lằn này nó phải thẳng. Nếu bạn che một mắt lại, bạn nhìn mấy cái lằn mà nó không có thẳng á, thì bạn có thể bệnh trong mắt đó, thì bạn phải đi khám bác sĩ. Nếu bạn không có cái này thì bạn đọc báo cũng được. Nếu bạn che mắt lại, xong rồi bạn mất một cái chữ, thì cái đó là có một cái dấu hiệu là bạn có thể bệnh trong mắt đó.
So another thing is that on the internet you can get the Amsler grid for free, and our own website for our office, justforeyes.com, has it, but it's everywhere on the internet. And you can even from the internet download a near card and test your own vision. So this is important also. You can cover one eye and test your vision. Tell the home audience that you can also get this in the internet.
Cái hình ảnh em the Good này thì bạn đi về nhà vô internet đó thì bạn cũng kiếm cái này được. Nếu bạn không có kiếm cái này thì bạn kiếm cái thẻ mật, the vision card. Cái này là bạn cũng download trên mạng thì mà bạn tự nhìn cái mắt. Okay.
And that it's important to go see an ophthalmologist even when you're first diagnosed with diabetes. So, and then if you have nothing wrong, just see an eye doctor, your optometrist or your ophthalmologist once a year. However, after 5 years of diabetes, one has to be careful and start having perhaps more eye exams. Yeah, tell our home audience about that in Vietnamese.
Okay. Bạn càng lớn tuổi thì bạn nên đi gặp bác sĩ nhãn khoa để thử mắt. Tại mình càng lớn tuổi thì mình có cái nguy cơ nó cao hơn, mình bị bệnh cao máu hay là bệnh tiểu đường. Rồi mấy cái này là nó ảnh hưởng về mắt.
And Victoria, when you volunteered in many clinics for all sorts of things, what is it that struck you about the Vietnamese population? As we know that we have many things written in Vietnamese, but people don't read them or access to these free written materials. Nobody gets them, even though we have them printed, like they're free brochures about heart disease, breast cancer. Tell us about the Vietnamese population that you've seen in the clinics.
A lot of them, like you said, Dr. Wu, a lot of them aren't aware about the resources that they have. They might go to the doctor and see these brochures, but they might think, oh, I'm not at risk, so they won't grab it, and they won't ask their doctors about it, or sometimes their doctors might not mention it. And when I was volunteering at the hospital, a lot of them, they do have access to these things, but again, they just don't read it, and they're not very aware about it, so it's something that we need to work on.
Also, culturally, I think many Vietnamese are Buddhists, and they feel that whatever happens will happen, and that they're very accepting of life cycles, and they feel, why intervene? And so many of them are extremely reluctant to have surgery, and they just want to lead their life peacefully. What do you think about that?
Well, a lot of the elderly Vietnamese patients, their reactions are just, you know what, I'm old already and there's just no saving me anymore. And what we should try to do is to tell them, you know, there are certain steps that they can take to either prevent further disease, to prevent exacerbation of their symptoms and their disease, and also to treat, because it's always possible, in most cases, it is very treatable. So yeah, we should definitely tell them and let them know that it's not over yet. The battle isn't over, and that they can still fight.
Also, sometimes it becomes a self-fulfilling prophecy. If you think, I'm old, it's going to happen. So then you wait to the very extreme when you have no vision in one eye and then no vision in the other eye. Then it's self-fulfilling because they didn't want to see anybody before, and they just want to live kind of their peaceful lives. So then it's very hard when we see them in the doctor's office when their eyes are filled with blood. Then we kind of have to tell them we have to intervene, and it's not like death. It's just, we can fix you and then you'll be better. So did you find that when you observed people in the South San Jose clinic? We were all together.
Mm-hmm. Yeah, I saw that in a few of the patients too. Like a lot of the illnesses and the disease, it is preventable. It can be treated, but a lot of them refuse treatment because they prefer other methods. More like a lot of them are very conservative, so they don't want to resort to surgery, and they're fearful in general too.
And sometimes they just like herbal medicine. Mm-hmm. They prefer herbal medicine because it's more accessible for them in the Vietnamese community. They don't have to go wait in a waiting room, stand in line, go to a pharmacist. They just go to one place. They get their herbal medicine, which is very much part of the culture in some of the rural areas of Vietnam. Tell us, when you were writing this book and it gave you insight into what to say to these patients about diabetes in Vietnamese. What is it that you would like to emphasize for them? Tell them in Vietnamese.
Ok. Thì maybe bạn mà có thể bị bệnh tiểu đường phải coi chừng, nhớ phải biết ăn mấy cái thức ăn mà nó tốt, ăn nhiều rau cải, đừng có ăn nhiều đường. Bệnh tiểu đường á, nó sẽ ảnh hưởng vô cái mắt, nhiều người không có biết cái đó. Thì bạn phải đi khám bác sĩ nhãn khoa để cho bác sĩ trị cái mắt nếu bệnh trong mắt. Tại mấy cái này là bác sĩ có thể chịu được, mà nếu bạn chờ lâu quá thì cái bệnh này nó sẽ nặng hơn.
Now, in that book, pass me the book. There's also a great thing where we give them the actual diagram of the eye, so they have an idea. It's in English and Vietnamese, so they know what we will be talking about in an ophthalmologist's office. And there's one more picture which I really think it's important that they have to try to exercise. Exercise is important, and 25 minutes a day. And the most important thing is for them to kind of understand the terms. So here is something about the BMI, which is important to be less than 30. And for Asians, they have even a slightly lower one. It depends on which one. So tell the home audience in Vietnamese about the BMI.
Ok. So nếu bạn có bị bệnh tiểu đường, nó quan trọng là bạn phải giữ cái số BMI dưới 30. So BMI á, là một cái số mà nó số cân nặng và về chiều cao.
And then the glycemic index of foods are important, that this is the way to see how a food breaks down to sugar fast or slow. We want foods that break down slow. So here are the glycemic index.
Ok. So bạn phải chú ý các chỉ số GI. So GI là một cái số tốc độ thức ăn biến thành đường trong máu. So bạn muốn mấy cái GI mà cái số nhỏ. So bạn nên ăn bông cải xanh, hay là măng tây, hay là đậu phộng, rau diếp. Mấy cái mà không có tốt á, mà có GI số lớn là nước ngọt, hay là bánh ngọt, hay là dưa hấu.
And we found that we created, our office created some apps called Asian Diet Watch. So I don't know if everyone will own a Droid phone, but family members will, and they can check to see if they're going to eat pho, whether it's good or not, or if they're going to eat other Vietnamese foods. And this is free. And we also have ones for people who have to eat fast food in the airport or wherever they have to travel, and it is also called diabetes fast food. So you can compare McDonald's hamburger to Papa John's pizza, and tell the home audience.
Thì nếu bạn muốn để biết thêm về mấy cái thức ăn mà tốt cho mấy người bệnh tiểu đường, thì bạn tải về áp dụng Android Asian Diet Watch hay là Diabetes and Fast Food. Mấy cái này là thì nó viết về mấy cái thức ăn mà bạn nên ăn, mấy cái nào mà bạn không có tốt cho bạn.
Now, the other thing is that we think it's really interesting is that when we did the prevalence there's 382 million people with diabetes in the world, they estimate. And to think that it's so widespread, and in the Asian population in America, because of the metabolic syndrome, we are at risk. The metabolic syndrome is if you have high blood pressure, whether treated or not, high cholesterol or lipids, whether treated or not, high triglycerides, and increased waist circumference over 40 inches for men, over 30 inches for women, and if you have abnormal fasting blood glucose, abnormal hemoglobin A1C, that it's important that you see a doctor because you may be at higher risk for developing diabetes and heart disease and stroke. This was discovered at Stanford. It was called Syndrome X approximately 15 years ago. And now every South Asian and Asian person has been tested, or we, not everyone, but we think that it's important that they be aware of it, and there's more consciousness about it because there's certain hospitals that have created the South Asian Heart Center or a South Asian Heart Institute, and because to address this problem. So once you may not have real diabetes according to your doctor, but nobody tested your hemoglobin A1C, nobody talked to you about metabolic syndrome, so it's important for you to know your risk. Because if you could have a fasting blood glucose of 110, but if you never tested your hemoglobin A1C, your hemoglobin A1C could be 7, which would put you squarely in the diabetes range. But because nobody tested it, you don't know. That is the 6-month report card versus the 24-hour report card. So tell the home audience the importance of testing and asking your doctor. And if every woman's a little chubby around the waist, we all have that. We had children, so it's hard to lose that baby fat or around our waist. But for women, it's hard, and especially if you're pre-diabetic or about to be diabetic, to get that really checked out. Tell us.
Okay. Yeah, so mấy người có bị bệnh metabolic syndrome là nó thường mấy người này có bị cao máu, hay là có high cholesterol, hay là nó có nguy cơ cao bị đau tim. Và mấy người này cũng có cái chu vọng eo lớn hơn 40 cho đàn ông, hay là 30 cho phụ nữ. So nếu bạn có mấy cái điều này thì bạn phải nên đi khám bác sĩ. Bạn phải thử cái hemoglobin A1C, cái đó là một cái số đo cái lượng lượng trong máu trong 6 tháng. Cái fasting blood sugar là một cái lượng lượng trong 24 tiếng thôi. Cái đó nó không có tốt bằng hemoglobin A1C. So bạn phải nhớ là phải đi bác sĩ, xong rồi thử máu để lên cái số này để cho bạn biết cái nguy cơ bị tiểu đường hay là bị bệnh trong mắt.
And there's free screening everywhere at the Department of Public Health, so you don't need to feel that you can't afford to find out if you're diabetic. And there's free screening at CVS periodically. There's free screening at many of the drugstores, where you can get a free blood pressure check. They will also screen for your blood sugar. And these simple tests are very important. You can tell our home audience.
Ok, bạn muốn thử tiểu đường thì bạn cũng đi vô mấy cái tiệm như Walgreens hay là CVS ở nhà, thì ở đó thì nó cũng thử máu cho bạn có biết có bị bệnh tiểu đường không.
So to wrap up for our home audience, what should we tell them? We should tell them that if you have diabetes, see your eye doctor and ask your internist about the hemoglobin A1C. And so.
Ok, thì bạn tốt nhất cho bạn ấy, thì bạn đi khám bác sĩ nhãn khoa để bạn coi có bị bệnh tiểu đường trong mắt không. Xong rồi bạn phải đi hỏi bác sĩ gia đình về cái số hemoglobin A1C. Cái đó là quan trọng nhất.
So thank you very much for joining us for our first show in Vietnamese and English about diabetes. And if you like our programming, donate to KSAR TV. It's a nonprofit, and you can write the checks directly. Thank you so much.